Hi, I'm Dr. Seth Force. I'm the Kamal A. Mansour Professor of Surgery and Chief of the Section of General Thoracic Surgery at Emory University Hospital in Atlanta. One thing that often comes up, when we're seeing patients with newly diagnosed lung cancer is that there are often clinical trials that are open to patients to try to improve on the current outcomes. And there's a couple of things surrounding, clinical trials that, kind of myths and things like that that probably should be dispelled. So, it's oftentimes not perceived well by patients where they think, oh, this clinical trial is a pure experiment. They're just going to give me some medicine and see if it works. And what patients really should understand is all these clinical trials are based in a lot of pre-clinical trial data that has shown a lot of benefit. And what we're trying to do is improve on cancer survivals that are not outstanding. And if you look at the overall lung cancer survival for stage 1 lung cancer, say, or any stage, it hasn't changed dramatically, in the last several decades. Some of that's changing with some of the new immunotherapy treatments and things like that. But really, the clinical trials are looking to improve on that even further. And so if you look at studies done looking at clinical trials, and there have been some good studies, most have found that patients have better outcomes on clinical trials. And the thought is that, notwithstanding what clinical trial it is, part of that's because they're followed more closely. So there's a lot more regimented follow-up per the rules of the clinical trial that the patients have to go through. And so they are imaged more frequently, they're followed more closely, and then things are found sooner. And that's been shown in multiple different clinical trials for many different kinds of cancers. But going back to the initial point is that these are not just experiments. These are clinical trials based on previous data that have shown efficacy, and that we're trying to improve on the current lung cancer survival rates. So if I were a patient, with lung cancer, I would want the best treatment, not the fastest or the easiest. I would want the thing that would be the most likely treatment to have me be alive 20 years from now. And that, usually involves being part of a multidisciplinary team involving, as we talked about before, surgeons, medical oncologists, radiation oncologists, a radiology team, an entire team that's going to guide your care, but then also potentially the patient seeking out places that can enroll them in clinical trials that might improve on the current lung cancer survival statistics. And I think it's a critical thing. And hopefully in the future, it's going to be more patient driven, not just, comprehensive cancer center driven.